My name is Dr. Eric Salud. I am a general dentist. What excites me most about the all-on-4 full arch restorations is how life transforming it can be. Most of the time, the patients come in and are um, either have missing teeth, have teeth that are failing, or have dentures that just don't fit very well. And so the all-on-4 treatment changes all of that, where a patient can finally chew what they want and have a great smile, but most importantly, have the confidence in social settings now so that they don't have to be afraid of teeth that move a lot or not being able to eat whatever they want. Well, the all-on-4 treatment is it's a procedure where we place four implants on the top and four implants on the bottom jaw. And what we do is we anchor teeth onto those implants. So a full arch of teeth on four implants on the top and a full arch of teeth on implants on the bottom. And they're permanent in your mouth and they're stable. What's different with traditional dentures are that dentures tend to move around. They're not very stable, and you're not able to chew very well with them. And with the all-on-4, you're able to chew whatever you want and not have to worry about your denture moving or popping out or anything like that. A good candidate for the all-on-4 restoration is anybody who has teeth that are failing, missing teeth, or teeth that you're just kind of sick of having to deal with all the time, that whenever you go to the dentist that something else is wrong, or the patient that just is done with dentures and not feeling comfortable with the dentures. A typical patient's relatively healthy, and ultimately the best candidate is someone who's really motivated to change their life. Someone who really wants to improve, not only improve their smile, but improve their eating capabilities as well. Traditionally, the only way to replace teeth before was through dentures, and dentures only provide about 30% of your chewing capacity as opposed to your natural teeth. And so, what the all-in-4 does is it allows you to chew up to about 100% of your chewing capabilities from before. So, you're able to chew pretty much whatever you want and eat things that you probably weren't able to eat before. The all-in-4 treatment, you're able to speak much more naturally. With the dentures, your palate is covered, so your speech tends to be off. But with the all-on-4, it just feels like natural teeth, so your speech is actually pretty normal. Well, the process all begins with the consult. What we do is we take a 3D X-ray of your whole mouth to see your bone quality and to determine if you're a good candidate or not. Then we'll review your medical history to see how healthy you are. And most importantly, we want to review your goals. Like, what is your end goal for this treatment? And we can talk about different sorts of options. Once we determine if you're a good candidate or not, then we can start the whole process. First is the surgery, where we remove the rest of your teeth and place the implants in at the same time. And then you actually go home with a set of teeth that are screwed into those implants. So right away, your smile has changed completely. Those implants have to heal for a few months, and then we start the process of making you custom teeth that'll fit perfectly into your mouth and that you'll be able to chew whatever you want and speak clearly and have all the confidence in the world. We expect these restorations to last a very long time. We're in this for the long term. Um, with proper maintenance and care, the implants themselves should last almost a full lifetime. Um, and the teeth themselves, if properly taken care of, they too can last quite a long time. They may need to be replaced after about 10 to 15 years, but usually they can last you a very long time. I had a patient once that came in and his teeth were just ground down to little nubs. He was very embarrassed about his teeth. He wouldn't even smile for any pictures, and his eating capabilities was pretty minimal. We did the all-on-4 treatment on him, and his life changed completely. He was able to chew whatever he wanted. He was smiling ear to ear, and was able to regain that confidence that he once had when he had all of his teeth. Well, technology has really changed the game with the all on fours. With the 3D image that we're able to take, we can predictably place the implants in the exact spots that we want, making the surgery go efficiently and smoothly. And with digital scanning, we're able to customize all the teeth to make them look as natural as possible. Otherwise, it would be a guessing game. So with the advent of newer technology, we are able to do this process, the all-in-four process, pretty effectively, smoothly, and efficiently. The first step to determine if the all-in-four is right for you is to first set up a consult. What we'll do at that consultation is take a 3D image of your jaw. We'll see if you're a good candidate or not. We'll review your medical history and we'll go over your end goals and give you different options for how we can help replace your teeth. And if the all in four option works for you, then we can get the process started.